Hi, I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients to become healthy and well without the use of drugs and surgery. If you've been following our gluten sensitivity series thus far, you've learned a lot about gluten sensitivity, what it is, how it affects our body, how do we test for it, what are some of the common symptoms and conditions that we experience when we're gluten sensitive, but what do we really do about it if we have a gluten sensitivity? Now, even though we may be gluten sensitive and not have celiac disease, there's still a variety of things we can do in our own lives to be able to avoid the symptoms that come from these foods, these inflammatory glutens and gluten proteins. As we've discussed in the past, gluten is typically found in wheat, barley, rye, cross-contaminated oats, many packaged foods, and other places of hidden sources of gluten. So therefore, if we're trying to avoid a gluten sensitivity reaction, the very first course of action to getting better is to avoid the food. It sounds crazy for some people to avoid things like wheat and barley and rye and bread and pasta and beers and oatmeal and things like this. But if we're trying to make our body have as little inflammation as possible so that our symptoms are able to go away, this of course is the most important step, is avoidance. So after we've avoided the food, is there anything else we can do? Of course there is. In fact, there's a certain enzyme inside of our body that if we have it, we will digest the food more appropriately, or we'll digest glutens more appropriately, and that's dipeptidyl peptidase 4. So that enzyme, if we are able to create it on our own, helps us to digest gluten and its various components, but not everybody makes that enzyme effectively. So taking DPP4, or dipeptidyl peptidase 4, in an enzyme form or in a capsule form, supplemental form, that's one way to help treat the gluten sensitivity reactions that you're getting. Of course, the first step is to avoid it. Secondly, we can supplement with DPP4 in order to help break down the accidental exposure that we're getting from glutens. In addition to breaking down gluten, DPP4 also helps break down a casein protein, which is found in dairy proteins too. Dairy is a common sensitivity reaction to individuals that have gluten. So therefore, taking DPP4 in addition to avoiding gluten is a great way to go about helping to treat your own gluten sensitivity. Once again, I'm Dr. Chase Hayden, and I'm a doctor at the Hayden Institute, where we help our patients to become healthy and well without the use of drugs and surgery.